Medical letters are essential tools for communication between healthcare professionals. They serve various purposes, such as referring patients, transferring care, or discharging individuals from a facility. Each letter type has a specific structure and content requirements to ensure clarity and continuity of care. Understanding the layout and purpose of these letters is crucial for effective patient management and seamless transitions between providers. In this video, we will explore the different types of medical letters, their layouts, and the key elements that must be included to meet professional standards. There are three main types of medical letters: referral, transfer, and discharge. Referral letters are used to send patients to another specialist or facility for further assessment or care. Transfer letters facilitate the movement of patients between departments or institutions, ensuring that all relevant information is passed along. Discharge letters inform the next provider about a patient's status as they leave a hospital or clinic. Each type has its own unique requirements, but all share the goal of clear communication and patient safety. Referral letter is written when a healthcare provider needs to send a patient to another specialist or facility for additional care or assessment. The purpose is to provide the receiving provider with a brief history of the patient, including their name, age, occupation, and the reason for referral. It also outlines the current situation and any actions needed. The referral letter ensures that the patient's care continues smoothly and that all relevant information is communicated. Transfer letters are used when a patient needs to be moved from one department or facility to another. The letter must specify when and where the patient will be transferred, the chief complaint, and the recovery status. It also includes details about the patient's admission, current condition, and any special requirements for ongoing management. The transfer letter is vital for maintaining continuity of care and ensuring that the receiving team is fully informed. Discharge letters are written when a patient is leaving a hospital or clinic. The letter informs the next provider about the patient's recovery status when they are being discharged and any follow-up actions required. It includes a brief history of the patient, their current situation, and an outline of the management plan. Discharge letters help ensure that the patient receives appropriate care after leaving the facility and that all necessary information is communicated. The introduction of a medical letter sets the stage for the rest of the communication. It usually consists of 2 sentences in the present tense, briefly outlining the purpose of the letter and providing essential patient information. For referral letters, the introduction explains why the patient is being referred and thanks the recipient for their attention. For discharge letters, it updates the recipient on the patient's status and recovery. The introduction is concise but informative, ensuring the reader understands the context immediately. Including patient details such as name, age, and occupation in the introduction is crucial. This information helps the recipient quickly identify the patient and understand their background. For example, a letter might state, "Mr. Smith, a 60-year-old farmer, was admitted for routine assessment." Providing these details ensures that the communication is clear and that the patient's identity is not confused with others. Introduction should also mention when, where, and why the patient was admitted. This provides context for the recipient and helps them understand the patient's journey. For example, the patient was admitted to City Hospital on June 1st for diagnosis of hypertension. Including admission details ensures that the recipient has all the necessary information to continue care effectively. When a patient is being discharged, the letter should specify the discharge date and the patient's recovery status. This information is essential for the next provider to plan follow-up care. For example, the patient is being discharged today after a successful recovery. Including discharge information ensures that the recipient knows when to expect the patient and what their current health status is. For transfer letters, it is important to mention when and where the patient will be transferred. This ensures that the receiving facility is prepared for the patient's arrival. The letter should also include the chief complaint and recovery status, providing a clear picture of the patient's current condition. Accurate transfer details help prevent misunderstandings and ensure a smooth transition. The chief complaint is a key element in medical letters. It describes the main reason for the patient's visit or admission. Including the chief complaint helps the recipient understand the patient's primary issue and guides further management. For example, the patient presented with chest pain. Clearly stating the chief complaint ensures that the recipient can prioritize care and address the most pressing concerns. Recovery status indicates how well the patient is responding to treatment or recovering from an illness or procedure. This information is vital for the next provider to assess the patient's needs and plan ongoing care. For example, the patient is recovering well and is ready for discharge. Including recovery status helps ensure that the patient receives appropriate follow-up and support. The main body of a medical letter is divided into labeled paragraphs. each addressing specific aspects of the patient's history and current situation. The structure should fit the case notes provided in the exam or clinical scenario. Typically, the main body includes present history, complaints, management plans, and any special requirements. Organizing the main body clearly ensures that all relevant information is communicated effectively. Present history describes the patient's recent visits and current condition. It includes details about symptoms, examination findings, and any investigations performed. For example, during today's visit, the patient complained of persistent cough. Examination revealed mild wheezing. Present history provides context for the recipient and helps guide further management. The main body should include the patient's complaint and the initial management steps taken. This section outlines what prompted the visit and how the issue was addressed. For example, the patient presented with abdominal pain and was managed with analgesics. Including initial management helps the recipient understand the actions already taken and plan further care. If the patient has a secondary complaint or current condition, it should be detailed in the main body. This provides a comprehensive view of the patient's health and ensures that all issues are addressed. For example, the patient also reported mild headache, which was managed with supportive care. Including secondary complaints helps the recipient prioritize and manage multiple health concerns. For transfer letters, the main body should include details about the transfer and the management plan. This section outlines any specific requirements for patient management and ensures that the receiving team is prepared. For example, the patient requires ongoing monitoring for blood pressure and regular medication adjustments. Providing a clear management plan helps maintain continuity of care. Discharge letters should detail the management plan for the patient after leaving the facility. This includes any follow-up appointments, medication instructions, and specific requirements for ongoing care. For example, the patient is advised to follow up with their GP in 2 weeks and continue current medications. A clear discharge plan ensures that the patient receives appropriate care and support. Past history includes relevant previous visits and medical conditions. However, if the letter is addressed to a GP, extensive past history may not be necessary, as the GP likely knows the patient. For example, the patient has a history of hypertension, managed with medication. Including past history helps the recipient understand the patient's background and risk factors. The main body should describe the patient's current situation, management, and response to treatment or recovery. This provides a snapshot of the patient's health and guides the recipient in planning further care. For example, the patient is stable and responding well to treatment. Including current situation and response ensures that the recipient has up-to-date information. The conclusion of a medical letter provides an overview of the current situation and makes requests regarding the management plan. It also offers further help if required. The conclusion is concise, summarizing the main points and ensuring that the recipient knows what actions are needed. For example, based on the above, I believe the patient needs further assessment. The introduction of a referral letter typically begins with phrases like "I'm writing to you regarding," or "Thank you for seeing." It mentions the patient's name, age, and occupation, and explains the reason for referral. For example, Mr. Smith, a 60-year-old farmer, is referred for further assessment of chest pain. The introduction sets the context and prepares the recipient for the details that follow. The introduction of a discharge letter updates the recipient on the patient's status. It includes phrases like "I'm writing to inform you regarding," or "His condition is improving and he's being discharged today." The introduction provides essential information about the patient's recovery and prepares the recipient for follow-up care. Urgent letters require immediate attention and often begin with phrases like "I'm writing this letter to request an urgent review." They highlight the need for prompt intervention and thank the recipient for their urgent attention. Including urgency in the introduction ensures that the recipient prioritizes the patient's care. The second sentence in the introduction often requests further management or advice. Phrases like "Your urgent assessment would be highly appreciated," or "I would be grateful if you could follow up," are commonly used. This sentence clarifies the action needed and ensures that the recipient understands their role in the patient's care. Present history includes descriptions of different visits, symptoms, and examination findings. For example, initially, the patient presented with fever and cough. On today's visit, symptoms had improved. Including present history helps the recipient track the patient's progress and plan ongoing care. Examination findings are a crucial part of the main body. They describe what was observed during the patient's assessment. For example, on examination, blood pressure was found to be elevated. Including examination findings provides objective data for the recipient and guides further management. Investigations such as lab tests or imaging are often ordered to clarify the patient's condition. The results should be included in the letter. For example, lab tests revealed elevated white cell count. Providing investigation results helps the recipient understand the basis for diagnosis and management decisions. Details about medication management, including prescriptions, adjustments, or discontinuations, should be included. For example, medication was commenced for hypertension. This information ensures that the recipient knows what treatments have been tried and what needs to be continued or changed. The letter should include any advice or instructions given to the patient. For example, the patient was advised to return if symptoms worsen. Providing clear instructions helps the recipient understand the patient's responsibilities and ensures continuity of care. Patient response to treatment or advice should be documented. For example, the patient made good progress and is scheduled for follow-up. Including patient response helps the recipient assess the effectiveness of previous management and plan future care. Details about subsequent visits, including new complaints or changes in condition, should be included. For example, on subsequent visits, the patient reported new symptoms. This information helps the recipient track the patient's ongoing health and address any emerging issues. Personal history, including special habits, medication, allergies, and chronic conditions, should be noted if relevant. For example, the patient is a smoker and has diabetes. Including personal history provides important context for the recipient and helps identify risk factors. Family history should be included if it is relevant to the patient's condition. For example, the patient has a family history of heart disease. Including family history helps the recipient understand genetic risks and plan appropriate care. Social history, including marital status, children, and living arrangements, should be included if it affects patient care. For example, the patient lives alone and requires additional support. Including social history helps the recipient understand the patient's environment and plan for necessary assistance. Requests related to the management plan should be clearly stated. For example, please ensure that the patient receives regular follow-up. Using emphasis and polite language helps ensure that the recipient understands the importance of the request and takes appropriate action. The conclusion provides an overview of the patient's current situation and summarizes the main points. For example, in review of the above, I believe the patient needs further assessment. The conclusion ensures that the recipient understands the key issues and what actions are required. The conclusion often includes a request for follow-up or management. For example, I would be grateful if you could manage her condition as appropriate. This request clarifies the recipient's role and ensures that the patient receives ongoing care. The conclusion may also request the recipient's expert opinion or advice. For example, your expert views on the diagnosis and management would be highly appreciated. Seeking expert opinion ensures that the patient receives the best possible care and benefits from the recipient's experience. The letter should offer further assistance if required. For example, if you require further information, please don't hesitate to contact me. Offering assistance ensures open communication and supports the recipient in managing the patient's care. All relevant reports should be attached to the letter. For example, all the reports are being attached to this letter. Attaching reports ensures that the recipient has access to all necessary information and can make informed decisions about the patient's care. The letter should end with a polite closing statement, such as, "Yours sincerely." This maintains professionalism and ensures that the communication is courteous and respectful. Medical letters use specific vocabulary to convey cause and effect, subject, addition, emphasis, contrast, sympathy, time, place, and sensitive language. Examples include as a result, in addition, on examination, and BMI of. Using appropriate vocabulary ensures clarity and professionalism in communication. Using sensitive language is important in medical letters. For example, BMI of instead of overweight or discomfort instead of pain. Sensitive language ensures that communication is respectful and avoids negative connotations. Summary: medical letters are structured documents that facilitate communication between healthcare providers. Understanding the types, layout, and essential elements of referral, transfer, and discharge letters ensures effective patient management. By following the guidelines for introduction, main body, and conclusion, healthcare professionals can provide clear, concise, and comprehensive information, supporting continuity of care and patient safety.